everyone, and happy Friday. So, we've had a wonderful week. I've had a wonderful week. Thank you so much for all the wonderful messages. I've sent out some very special shout outs to some people in our low carb world that have been so kind as to start reading the advanced copies of our book, The PCOS Plan. And so that was lots of fun, and I'm very honored to have the opportunity to share those comments with you. So that's been a fun week. I've done a few videos this week, Monday, Tuesday, Wednesday, Thursday. So if you didn't get to them, please go and have a look. They're PCOS questions that you've sent to me that I've answered here on my Instagram account, and also I've posted them on my YouTube account. So go ahead and have a look at those. So today, in my opinion, is actually the most important, well, at least one of the most important topics and videos that I'm excited to do and talk to you about. It might be a little bit longer than the other videos. Let's see how this goes. So today's topic is pregnancy and PCOS. So I've gotten quite a few questions from you guys. The first question, and I think this is super important and it's well addressed in our book. Are PCOS women infertile? I think many of us, including myself, and you can see that picture back there, know that PCOS women are not infertile. In fact, PCOS women are about 80% of all cases at fertility clinics or infertility clinics, whatever you want to call them. And they're actually quite successful in comparison to other women that have other types of infertility challenges. Why are PCOS women more successful at these fertility treatments? Well, that's because they have a lot of follicles, and there's a whole bunch of other scientific reasons, and that's what I'll explain in our book. So no, PCOS women are not infertile. Can they become more fertile? Yes, they can. So what is the fertility concern of PCOS women? It is the fact that they are very commonly have irregular cycles and irregular or absent ovulation. So of course, if you're not ovulating, no baby. So what can you do about that? Well, it seems that if you correctly learn how to lower your insulin through diet and fasting, that's what I did, and that's what a lot of other people have done, you will be able to regulate your cycles and start to ovulate, and boom, baby. So there's that answer. Very important. Thank you for sending that in. The next question is how to prepare for pregnancy as a PCOS woman. What is the best diet and or intermittent fasting schedule? This is a great question. Although not easy to address here. However, I do want you to know that when we are doing a pregnancy or fertility or PCOS protocol, we are taking into account a woman's cycle. It is very true that a lot of women that come to us, myself personally, sometimes come with no cycle. So not uncommon for me to see women that haven't had a menstrual cycle in years, 3, 4, or more years. So this might be you. Therefore, our protocol is going to focus on that. It's going to focus on the fact that you don't have a cycle and you don't ovulate. So we're going to use diet and intermittent fasting to lower your insulin and get you more regular and ovulating. And this is very common, and many women report that after 3 to 4 months of a low carb diet and intermittent fasting protocol, all of a sudden, miraculously, they have a cycle and they start to ovulate. So there is an intense protocol. And yes, often we can use various types of fasting schedules to achieve that and get to that point a little bit quicker. Okay, so that's a very good question. Now, once somebody's cycle is regular and you are ovulating, we take your cycle into account as far as creating your intermittent fasting schedules. Of course, that just generally, let me tell you that if I look at fasting for a woman that's trying to conceive, I'm going to try to do this safely, as safely as possible. And I'm going to teach you how to do that. So from day one to the day that your period comes to the day of your ovulation, and I'm sure people trying to conceive are checking for ovulation, but usually ovulation is around day 14. So in those 2 first weeks of your cycle, we can do a whole bunch of intermittent fasting schedules. Post ovulation, we focus on what's called TRE, which is time restricted eating. Basically, we're going to focus on some very good, rich, nutritious meals. No snacking. Okay, so there is a cyclical sort of protocol and pattern, and this works out really, really well. All right, so let me see what's up next. So, is it safe to get pregnant with PCOS? What are the risks to mom and baby? This is the best question. And this is something I highlight in my lectures and in our book. No, PCOS women are not infertile. Therefore, you can get pregnant with PCOS. Fertility treatments can be very successful in getting PCOS women pregnant. Is this a really good idea if you haven't addressed the underlying cause, your metabolic syndrome, insulin resistance, and really overall PCOS? It's not the best idea. I speak from personal and professional experience. I did get pregnant very, very quickly with both of my children, with both of the attempts. I did not reverse PCOS. I did strategically use a low-carb diet, and I very quickly got pregnant. First time at 32, second time at almost 36. So first time almost 33 years old, second time almost 36 years old. I used a low-carb diet and very quickly got pregnant, even when fertility treatments didn't work. However, I wasn't aware at the time of all the things that you guys might be aware of now, or at least that I hope to share with you and we talk about in our book. The pregnancy complications of a woman with PCOS that does get pregnant. There are many, and we talk about this quite a bit. Abortions, miscarriages, spontaneous abortions, and miscarriages are very common. Preeclampsia and eclampsia, which is a more severe form, pregnancy hypertension, gestational diabetes, and many more. High risks to the mother, high risks to the baby. Babies born to a woman with PCOS are at a much higher risk of neonatal mortality and more incidences of babies being born either too big for gestational age or too small for gestational age and having to go into the NICU, the intensive care unit. Also, these children, like my children, born to women with PCOS, are at a much higher risk for developing metabolic syndrome in childhood and as an adult. So, is it safe to get pregnant with PCOS? Although that's a loaded question, I pose to you, and I'd like you to think about the fact that PCOS is very easy, and this is my hopeful message to you. I want to leave you on a very positive note. PCOS is very easy to reverse and prevent. And I hope that my videos and our information on our website, thefastingmethod.com, can help you get started on this journey if you haven't already. It is a great idea for you to do what's called a preconception protocol, 3 to 4 months of getting yourself real healthy, and then go for it. Try to conceive. You're very likely to get very good outcomes and be very happy with the outcome. At least I hope so. So here we have it for this week, my very last video for this week, but I am coming back next week with another giveaway. So stay tuned for that. Please follow me on Instagram if you don't already at Nadia_Patiguana. And I also have a YouTube channel that I would love for you to subscribe to and stay tuned to any updates that I have. I will share with you guys. Thank you so much. Have a great weekend.